Okay, what we're doing today is putting a head post on a mouse in order to restrain it for the behavior. What we need in terms of tools are our usual surgery tools: sharp forceps, blunt forceps, I like the suture tying forceps, some scissors. We need a scalpel with a number 10 blade, and I would change the blade every 2 to 3 animals, just because we're going to use this to shave the animal, and the sharper and fresher the blade is, the less nicks you're going to make, especially the first time you try this. Then we're going to need our little drill here to drill the pilot holes for the bone screws, and it has this little stop on here so that we don't drill too deep. One of my favorite tools is this little scraper here. It's multi-purpose. You can use it to make small cuts. You can use it to scrape. On the back side it has a little bone chisel if you need to work with that. And we have this modified watchmaker's screwdriver, which is for the bone screws, the M1x3 stainless steel screws that we're using to anchor the head post in the mouse's skull. So they're tiny, and to get them into the pilot holes, you can either try by holding them with the forceps and then screwing them in, or you use this, which is basically just a watchmaker's screwdriver with a little support around it. So you thread the screw in. Oops, yeah, better than this. And it holds the screw steady, and you're going to see that later on as we put those in the skull. This comes in really handy. We also have the pre-made head holders, which we make using this little mold where we can make 9 at a time, and I can explain to you how to make that off the video. If we have more than one animal in the cage, and we're going to want to keep them together and not house them separately, what we can do to mark the animals is actually use the bone screws and mark the bone screws. All I'm doing is color in the head of one bone screw with just a Sharpie. And since we're going to have 5 screws in the skull of the mouse, we can just count them through 1, 2, 3, 4, 5, and put the marked screw in a known location, and we'll mark that on the cage. And so that, since the dental acrylic that we're using is clear, we can then easily tell the mice apart in the cage. We're also going to be using dental acrylic, which is the standard dental stuff. It comes in 2 components, the liquid and the powder. And for mixing trays, I'm using old bottle caps. It's just the perfect amount. And we're going to need 2 portions for each animal. We also need super glue, and it comes in different viscosities. I'm usually using either medium or thin. And we're going to use the super glue accelerator, which is basically something you put on there that flash polymerizes super glue. You'll see how that comes in handy too. We're going to need some Q-tips, and for the shaving, we're just going to have some warm water with soap in it. And I think that's it, and we're getting ready for the mouse. Oh, wait, could you stop, please? So we take the mouse and put it in the anesthesia box. And just for getting it under, we're setting the flow rate at between 0.6 and 0.8, and set the ISO to full blast. It's going to take a little while until the mouse is under.
How long does it usually take?
About a minute.
Oh.
So the longest part of it is flooding the lines and flooding
Purging
the
them?
chamber.
Oh,
yeah.
purging them, yeah.
Yeah.
What is the compound?
It's isoflurane,
Okay.
just a standard anesthetic here. Induces quickly and has virtually no side effects, and it's almost impossible to overdose a mouse.
Oh, no
It's
kidding.
nice, yeah. It's like you have to have it on the mask and give it the full concentration for minutes before it actually dies.
Oh.
So if you accidentally leave it in the, well, that doesn't interfere.
Okay.
No.
That's my S cable.
Okay, once the mouse is under, we set the isoflurane to 2.
Should I go split screen?
Yes,
Okay.
that's a good idea. And we switch from the chamber to the mask.
You can see, I'll point this so you can see it, okay?
Mm-hmm. And set the mouse in the mask. And line up the mouse a little. First thing we're going to do is trim the whiskers so that we don't accidentally glue them into the head post. So there are 2 above each eye. You can just snip, and then the ones around the nose, of course, just snip them and put them to the side. And then, because they don't blink as while they're under anesthesia, and in order to protect the eyes from the dental cement, we also put some of this lubricant on the eyes. Just a little dab on both sides. And before we start any cutting, just make sure the foot pinch reflex is gone, so just squeeze the toes and see if it... So he has a bit of the reflex left, so we crank up the anesthetic just a little more. But the first step is shaving.
Bias the camera a little to the left. Or the other left, I'm sorry. There you go.
There we go.
Thank you.
Okay. And the first step is shaving. First we take some of our soapy water and put it on the skull, on the head. Make sure that everything's soaked and all the way down, so massage it in a little. So we want to shave from about where the eyes are to just behind the ears. Do I need to do a white balance on the camera? 'Cause it has one.
Yeah, go ahead and do your white balance, because I think you do need it.
It's better.
Yeah, that's fine.
So just drench it, make sure that the entire skull is covered. And then we take the scalpel blade, pull the skin tight, and this takes a little practice. So in the beginning, you're gonna leave a lot of nicks, especially with animals that, like this one, have these black moles where the skin is tougher, so, and the hair is a little coarser. So you'll see here, normally it's a nice pink, but some animals like this one have this black spot. So just hold the blade at a very shallow angle, pull the skin tight, be extra careful around the eyes because of course you don't want to cut them. And take your time. It's not a race. See, I left a little nick too. It's no big deal. It'll heal. Go all the way back to the neck. Next we're going to remove all the excess hair. And I'm keeping just a fold of paper here where I can dispose of the hair. That's out of the way. And here at the front, set this up, because this would also get caught in the head post. I just trim this with the scissors. Line up the mouse again. Zoom in a little. Next we're going to make a midline incision from just behind the eyes to right between the ears to expose the entire skull. What we want is area exposed from just before Bregma to well behind Lambda. Again, pull the skin tight and just a clean incision down the midline. And again, if you have a mole like on this guy, the skin is a little thicker and there's going to be some bleeding. With normal skin, it's not this obvious, and there should be almost no blood at all. So we have Lambda and Bregma off to the sides. Now we need to remove the periosteum, which is the skin and a very thin layer of muscle that's here on top of the skull, which we have to remove, otherwise the head post would just be swimming on top of this and not last. So what we do is we grab this and split this along the midline and scrape it off the skull. Careful for where the eyes are, you don't want to poke in from the back. And again, all the way to the back. There's thicker neck muscles back here, you can split those a little. And if your anesthesia is too shallow, you'll notice it, because then the mouse will start twitching. This is very sensitive. This mouse isn't twitching, so anesthesia is just right. It's breathing steadily. So scrape it off the skull, scrape it off along the suture lines. Sometimes there is a little blood vessel coming into the muscle from along the suture line. If you nick it, no big deal. It'll stop bleeding quickly. Then you do the other side. It gets easier once it's dried out a little. It's easier to grab and just peel off. Now, especially with the animals with a mole like this, in order to prevent the skin from pulling in and then maybe just sitting under our head post, what we're going to do is just trim about 1 millimeter off the edge of the wound, starting here in the back. So just grab this. And cut all the way forward on both sides. Next step is to scrape any remaining periosteum and muscle and gunk off to the sides. This is where my little scraper tool comes in. Works pretty well. Then we're going to take a Q-tip and soak it with alcohol and wipe off the skull, which disinfects, it stops bleeding if there is any, and it also degreases the surface of the skull. All helps to make the glue stick better. And once the surface of the skull remains dry, we take some super glue, either the thin or the medium, whatever works better for you. Fill that in another bottle cap and put a generous layer of it over the entire skull to seal the skull, and it also hardens. Once we polymerize it, it hardens the skull, adds to the stability. And it also seals the edge of the wound and locks it in place so it doesn't creep in as we're putting on the head post. So a nice thick layer, and then without the accelerator, this would take a couple minutes to dry out. With the accelerator, we just pick up a drop it onto here, and you can see how the stuff, it's almost like ice freezing over, polymerizes immediately, and so it's all dry to the touch and ready to go. So the first step of the actual surgery will be to drill the pilot holes for the head post. The landmarks are obscured now, but the midline's coming down here, then you got lambda back here with the suture lines going left and right, and bregma up front, suture lines going back and forth. We're going to put bone screws, 2 each, into the large plates that we see here, the parietal plates, and 1 screw here in the back in the inner parietal plate. And going to drill the pilot holes with the pin vise here. And we try to, so what you do is you hold the head of the mouse to hold it steady, not too hard, because you can actually kill the mouse if you press too hard. And if it starts breathing heavily, just let it go and wait a minute or two before you continue. But grab it and start with the pin vise in a back and forth, and take some practice. But eventually you'll be able to tell as you're going through, and so you won't go too deep. And you want to space the holes nicely so that you have room for the heads of the screws. So if you time it right, you can feel the drill going in just then. Little blood's no problem. And there's definitely going to be blood in the for the last screw in the back, because that bone is highly vascularized. 1, 2, 3, 4. And the one here in the back, that bone is distinctly double layered. You'll feel you go through one layer here, and then you have to drill some more to get through the second layer. And there's often some blood coming out of here too, but it's really no big deal. Just take a Q-tip before you put the screws in, dab off the blood, and if there's a lot of blood coming out, you can actually use one of the bone screws and plop it in and use it as a cork. But it usually stops within a minute or two anyway. Just make sure that all the debris is gone and that it's dry. And now we can take our little special screw holding tool and you can either put the screws in dry and then add some super glue to the base of it after you have them all in place, or like me, I dip them in super glue, and then of course you have shorter time to get them in place and into the skull. What you do is you set them down and give them about 4 or 5 turns in, and then you can either wiggle them off, or you can hold the base of the screw like so and pull off the tool. This one also has the advantage of giving you a gauge of how deep you are in. If you're at the right depth, it's about the same size as the thickness of this forceps. And just reload your tool. And the way we number the animals are, we number them clockwise, 1, 2, 3, 4, 5. And this animal will be at number 2, so I'm taking the Sharpie stained screw next, and I'm going to put that in the number 2 hole. What you should also try to do is get the screws in at a slightly different angle so that the stress lines, when it pulls on the head post, are distributed, so that if it's pulling in one direction, it's not pulling the same screws in all in the same direction out, but there's actually a slight angle from screw to screw. So you see, this screw is black.
Which screw is that?
Here, the number 2 is
okay,
black.
there you go.
That's the one that's marked with Sharpie. It'll come out more once we put the actual dental acrylic on. Two more and we're done. Mm. go. And the last one. So notice how the screws all come at slightly different angles, sort of like a crown. And then before we start putting on the dental acrylic, make sure that the screws are all at about the same depth. And if they aren't, you can correct by just taking the watchmaker's screwdriver and giving it another half turn in or out. Okay, in step one of the head post, actual head post building now, we're going to take some dental cement, mix it up, and first cover the surface of the skull and the edge of the wound, and then we're going to build up a pedestal around the screws to finish off about level with the head of the screws. And with this mix and the dental acrylic, we have about a minute of working time. So you just have to be quick, and you want to work with the stuff while it's not too thick, and stop working with it and get a new batch once it gets really doughy. So while it's really thin, it's good to spread around the edges and just get an even cover on the skull and around the bases of the screws. And then as it gets harder and a little thicker, I can start working up the bodies of the screws here. And to harden it slightly, you can blow on it. Some more on here. Just sculpt a nice even pedestal here. It starts creeping. Just pull it back and blow on it. Okay, and once we're at the top of the screws, we're ready for the next step of installing the pre-made head holder. And while the first stage is still sort of halfway soft, so that it sticks a little, we drop it on here, press a little, and then line it up so that it's aligned with the mouse, with the midline, and also about roughly earth horizontal. Keep it in place, and then with the next batch of dental acrylic, we're going to incorporate it into the actual head post. What we want is no sharp edges, nothing where they can get their fingers in and pull or get dirt in. And we also want to cover the edge of the wound nicely. So I'm going to start around the edge of the head holder so that it bonds with the rest of the pedestal. Careful not to drop any into the threads of the screws. If you do that, you're just going to have to start over, remove it, and use another one. And if you can't get it off anymore, you're going to have to wait until it's all hard and then drill it off and put a new one on. So don't do it. And then you sculpt around the edge of the wounds and the screws so that you have an even and smooth surface. careful at the eyes, but since we have this protective goop on there, if you happen to drop some on, just quickly take a Q-tip and wipe it off together with the goop. And here we go. A little dent back here. Even out. And that's the head post. Now we just need to wait till it's dry enough before we put the mouse back in the cage. So it takes about a minute for the stuff to be hard enough. And while it's doughy, you can still form it a little just to make sure everything's good. You can wipe the goop off the eye now. And also, if the ears are compressed like this, just open the ears so that the animal doesn't freak when it wakes up. And then you can turn off the anesthetic, but let the oxygen flow, and wait until reflexes return before you put the mouse back in the cage. And you'll notice right now the head post is still a little soft, but it'll be hard enough by the time we return the animal. And it'll also get completely clear once it's dry. And then we can tell from the outside of the cage, you can see the marked screw underneath here, and it's going to be really obvious once it's completely hardened and clear, and you can clearly tell the animals apart. So that this would be number 2. So 1, 2, 3, 4, 5, the screws. And then before the first experiment, we usually give them at least 2 days to recover, but you'll notice that already a few hours after the surgery, they'll behave like nothing ever happened, and it's just like a part of their body then. And that's this surgery.